Female infertility, diagnosis and treatment. When should treatment be started? Treatment of infertility depends on the cause, age of the patient, and how long she has been infertile, personal preferences, and her general state of health. Diagnostic tests. In addition to a general physical examination by the gynecologist, some specific fertility tests may include ovulation testing. There is an ovulation prediction kit available over the counter to detect a surge in luteinizing hormone that occurs before the ovulation. There is a blood test that can detect a rise in blood progesterone levels, a hormone produced after ovulation. Other hormone levels, such as prolactin, can be checked. These may help to confirm or deny ovulation. Ultrasonography or sonohysterography. Pelvic ultrasound is useful to diagnose polycystic ovarian disease, myomas, intrauterine polyps, and congenital anomalies. Enlarged blocked fallopian tubes, hydrosalpinx, can also be diagnosed by this method. The recent introduction of sonohysterography improved the diagnostic role of ultrasonography in female infertility. Research has shown sonohysterography is more sensitive and specific, yet less intervening than Hysterosalpingography, though the former is more accurate in the evaluation of the uterine cavity and later in the diagnosis of tubal infertility. Hysterosalpingography. During this procedure, X-ray contrast is injected into the patient's uterus and an X-ray is taken to detect any uterine anomalies. This test also helps to detect tubal patency if dye spills out of tubes into the abdominal cavity. In a few women, this test improves fertility by opening the fallopian tubes. Laparoscopy. It may be helpful to examine the surface of ovaries, especially surface irregularities or a follicular cyst suggesting normal ovulation. Multiple cysts usually point towards PCO. Chocolate cyst or endometriosis pelvic lesions could be diagnosed with laparoscopy. Other endocrinological tests. TSH or thyroid stimulating hormone levels suggest if the cause of infertility is hypothyroidism or hyperthyroidism. Serum luteinizing hormone levels may help make a diagnosis of PCO. For raised androgen levels, testosterone or dihydroepiandrosterone sulfate and rarely cortisol and ACTH levels are done. Treatment of female infertility. Treatment and number of sessions vary depending on the cause and severity of the disease. Some common treatments are: Number 1. Stimulating ovulation with fertility drugs. Women who are infertile due to ovulation failure, fertility drugs help to induce ovulation. Number 2. Intrauterine insemination, IUI. In this procedure, healthy sperms are directly placed in the uterus around ovulation time to maximize the possibility of fertilization, thus bypassing cervical mucus. Number 3. Assisted reproductive technology. This includes fertility treatments in which egg and sperm are handled. This includes IVF or in vitro fertilization as the most common ART. Multiple eggs are stimulated first and when ripened then retrieved from the ovary, fertilized with sperm in a dish in the lab, and when grown into embryos, then implanted in the uterus several days after fertilization. Other techniques sometimes used in an IVF cycle are ICSI. An intracytoplasmic sperm injection is a specific form of IVF in which a healthy sperm is injected directly into a mature egg. Assisted hatching. In this technique, the outer covering of the embryo is opened to help it hatch, as it could help the embryo to implant in the uterine wall, leading to higher pregnancy rates. Gestational carrier. Women who have problems in the uterus like myomas, congenital anomalies could opt for this technique. In this case, after IVF, instead of implanting an embryo in the biological mother's uterus, it is being placed in the uterus of a carrier for pregnancy who volunteers for this process. Number 4. Surgery to restore fertility. Surgery could be an option to treat anomalies such as the uterine septum, endometrial polyps and fibroids, endometriosis, or pelvic adhesions. It could be done as laparoscopic or open surgery depending on the size and nature of the lesion. Complications of infertility treatments. Multiple pregnancies. As a consequence of stimulated ovulation, twins, triplets, and quadruplets is the usual outcome. Generally, the greater the number of fetuses, the higher the risk of premature labor and pregnancy-associated complications. Ovarian hyperstimulation syndrome. Fertility medicines sometimes cause OHSS, in which ovaries become swollen and painful. Symptoms include mild abdominal pain, bloating, and nausea. Rarely it presents as an emergency with the rapid weight gain and shortness of breath. Bleeding or infection. Reproductive surgery or ART may result in these complications rarely.
Thanks for watching. Please like, subscribe, and share. Stay safe and sane. Science will win.